What is the P-long treatment? Have you heard about this method for penile enlargement? Have you seen claims suggesting significant increases in size without surgery? Does it really work the way it is presented? Is it as effective and reliable as some sources claim? And most importantly, does it meet the standards that we expect from medical treatments? If you have come across this topic, it is important to analyze it carefully. Because in medicine, not everything that sounds promising is supported by solid evidence. I'm Dr. César Noval Font, plastic surgeon and medical director of Clínica NEF, with clinics in Spain, Miami, and Mexico. We specialize in penile enlargement procedures, including lengthening and girth enhancement, as well as gender affirmation surgery. On our Spanish YouTube channel, we have helped millions of people better understand their bodies through clear, honest, and medically accurate information. This English channel has been created with the same purpose: to help you understand your body, improve your sexual health, and make informed decisions based on evidence, not marketing. Now, let's start by understanding what the P-long treatment is. The P-long protocol is presented as a non-surgical method to increase penile size through a combination of different techniques. These may include traction devices, vacuum therapy, injections such as platelet-rich plasma, and specific exercises or routines designed to stimulate tissue adaptation. The idea behind this approach is that, by combining multiple forms of stimulation, the tissue can respond over time and produce measurable changes in length and girth. On the surface, this sounds appealing. It suggests a comprehensive system. It suggests a structured protocol. And it suggests that results can be achieved without surgery. But this is where we need to be precise. Because in medicine, we do not evaluate treatments based on how they sound. We evaluate them based on evidence. Now, let's analyze the first critical point. Some claims associated with this treatment suggest extremely high success rates, even approaching 100%. From a medical perspective, this is a red flag. There is no treatment in medicine with a 100% success rate. Not in surgery, not in pharmacology, not in any therapeutic intervention. Every treatment has variability. Every patient responds differently, and every procedure carries some degree of risk or limitation. So, when we see claims of universal success, we need to question them, not from a negative perspective, but from a scientific one. Now, let's move to another important point: scientific evidence. Some of the support for this protocol is based on studies with a very small number of patients. In some cases, around 15 individuals. This is extremely limited. In clinical research, small sample sizes reduce the reliability of the conclusions. They increase variability. They reduce statistical power. And they make it difficult to generalize results to a broader population. In other words, what happens in a group of 15 patients does not necessarily reflect what will happen in hundreds or thousands. Now, another aspect that requires careful analysis is the absence of reported complications. When a treatment claims to produce changes in tissue structure, whether through mechanical stimulation or injections, it is not realistic to assume that complications are zero. Every intervention has potential side effects. Even simple procedures can produce variability in outcomes. So, the idea of zero complications should be interpreted with caution. It does not necessarily mean that complications do not exist. It may mean that they are not fully reported or that the study design does not capture them adequately. Now, let's talk about the biological plausibility of the method. Some components of the protocol, such as traction devices, do have a scientific basis. Tissue expansion is a known concept in medicine. When applied correctly over time, it can produce changes. However, these changes are typically modest. They require consistency, and they are not comparable to surgical results. Other components, such as platelet-rich plasma, are more controversial. PRP is used in different areas of medicine, but its role in penile enlargement is not clearly established. The evidence is limited, and the results are variable. Now, when multiple techniques are combined into a single protocol, it becomes even more difficult to determine what is actually producing the effect. Is it the traction? Is it the vacuum therapy? Is it the injections? Or is it a combination? Without proper controlled studies, it is very difficult to isolate variables. And this is essential in scientific evaluation. Now, let's address an important point about expectations. Many men are attracted to non-surgical solutions because they appear safer, simpler, and more accessible. And this is understandable. But we need to differentiate between improvement and transformation. Some methods may produce small changes. Some may improve function. But the idea of significant, consistent, and predictable enlargement without surgery should be approached with caution. Now, from a clinical perspective, when we evaluate any treatment, we look at several factors: consistency of results, reproducibility, quality of evidence, risk profile, and long-term outcomes. These are the pillars of medical decision-making, and any method that does not meet these criteria should be analyzed critically. This does not mean that it has no value, but it means that its limitations must be clearly understood. Now, let's be very clear. Patients deserve accurate information. They deserve to know what is possible, what is probable, and what is uncertain, because only with that information can they make informed decisions. Now, in our clinical practice, we see patients who have tried multiple methods. Some have experienced minor improvements. Others have not seen significant changes, and many come with expectations that have been influenced by marketing rather than evidence. This is where education becomes essential. Now, let's talk about the difference between protocols and treatments. A protocol is a combination of steps, but a protocol is only as strong as the evidence supporting each of its components. If individual components have limited evidence, combining them does not automatically create a stronger treatment. This is a key concept. Now, let's also consider the time factor. Many of these protocols require months of consistent application, daily routines, strict adherence, and patience. This is not a quick solution, and this is something that must be clearly communicated. Now, let's return to the central question. Is the P-Long protocol a reliable, evidence-based solution for penile enlargement? From a strict medical perspective, the answer is that the evidence is currently limited. There may be some potential in certain components, but the overall claims should be interpreted with caution, especially when they include statements that are not consistent with how medicine works, such as universal success or absence of complications. Now, this does not mean that patients should not explore options. It means that they should do so with realistic expectations and proper medical guidance. Now, let me leave you with a key idea. In medicine, the goal is not to promise. The goal is to inform, because informed patients make better decisions, and better decisions lead to better outcomes. If you found this explanation useful, subscribe to the channel. Here, we approach male sexual health from a medical and professional perspective, helping you understand your body and improve your quality of life based on evidence, not marketing.